So normally when your body responds to an infection, you develop what are called polyclonal antibodies. Monoclonal antibodies are basically therapeutics that have been developed in the laboratory to respond to either different parts of your body's defense system or to foreign invaders like the coronavirus. Some of the very first monoclonal antibodies began to be used in 1985, and there are more than 100 monoclonal antibody therapeutics that are being used now. The things you see on TV, like advertisements for treatments for psoriasis, rheumatoid arthritis, Crohn's disease, are monoclonal antibodies. They are different than the coronavirus monoclonal antibody in the sense that they're targeting part of that patient's defense system or antigens that that patient has that cause them to have things like rheumatoid arthritis or Crohn's or psoriasis. The monoclonal antibodies that we use for COVID are specifically targeting the virus. Well, the coronavirus is named the coronavirus because the virus has spike proteins all the way around the virus that make it look like a crown, and that's where the coronavirus name comes from. Those spike proteins are the way the coronavirus attaches to your body's cells, for instance, attaches to your lung cells. The monoclonal antibody binds up all those spike proteins. The coronavirus cannot bind to your cells, and your body can clear the virus more rapidly. So the very first monoclonal antibody that was approved was one called bamlanivimab. None of them are easy to say. And that was on November the 9th of 2020. Then the casirivimab indivimab was approved around the 21st of November. Then later in early 2021, etesivimab was combined with the bamlanivimab. And then one that came out later in the spring of 2021, sotrovimab, is also approved. So the FDA, as I said, in November of 2020, approved the emergency use authorization of these COVID monoclonal antibodies. You have to have a positive test for the COVID-19 virus, and you have to have a risk factor that would put you at higher risk for developing more severe disease, and you have to have mild to moderate symptoms. The FDA has continued to expand who is eligible to receive, but patients that have chronic medical conditions such as diabetes, heart disease, hypertension, lung disease, kidney disease, people who are overweight with a BMI greater than 25, patients that are greater than 65 years of age, and patients that have any type of immunosuppressive condition or medication that suppresses the immune system. More recently, they expanded to include pregnancy and also expanded the BMI from greater than 35 to greater than 25. The people that are eligible are anybody that's over the age of 12. Specifically, that's more children that have neurodevelopmental disorders or have dependency on a medical technology device like a tracheostomy, gastrostomy tube, that sort of thing. And also sickle cell is included in that as well. As of August the 1st, they also expanded not only from patients that have COVID, have mild to moderate symptoms of less than 10 days duration, and have one of those medical conditions. As of August 1st, they also expanded to include possible post-exposure prophylaxis. So that would be somebody who's had close contact with known COVID or suspected COVID, has one of those medical conditions, and is not vaccinated, has had their vaccine last dose less than 2 weeks ago, so they've not had time to mount a full immune response, or have a medical condition that would prevent them from developing a full response, like a transplant patient or somebody who's on one of those immunosuppressive medications that might make them not have developed a good response to their vaccine. The mechanism that the COVID monoclonal antibodies work by is by attaching to the virus spike protein and helping your body clear the virus more rapidly. The longer you wait after you develop symptoms, the more that virus, it's already going to be attached to your cells, and the monoclonal antibody can't unattach it. So the earlier you get this treatment, the faster you clear the virus, the less severely ill you will become. Over 600,000 people in the United States have received the COVID monoclonal antibody treatment since November of 2020. It is relatively safe and well tolerated, but there are potential complications or allergic reactions from any type of IV medication. And so when you give the infusion, it's an IV medication. You start an IV, it infuses over 30 minutes, and then we watch patients for an hour afterwards just to make sure they're not having any allergic reaction. If they had an allergic reaction, it would be managed with things like antihistamines and Solumedrol. Not really any side effects. The only contraindication to receiving the COVID monoclonal antibody treatment is if you've had a prior allergic reaction to that particular COVID monoclonal antibody treatment. We have had a few patients. We've infused a little short of 400 patients here at Roanoke Memorial since we began giving it in December. And we've had a few patients develop fevers and hard chills after receiving for a few hours, and we have managed those with Tylenol. So this is a single treatment, so a single infusion. The infusion for the medication that we have available at Carillion is the casirivimab, indivimab. It runs in the vein for 30 minutes, and then we watch for the hour to make sure no side effects. Currently at Carillion, we have several different sites. We have one South Infusion Center at Roanoke Memorial Hospital. We have the Infusion Center at the New River Valley Medical Center, and very soon our Postal Drive Infusion Center will reopen. With the decreasing numbers of COVID-positive patients in our area, the Postal Drive Infusion Center closed in June, but is reopening this week. Well, the federal government provided the casirivimab and indivimab for free. So the infusion of the medication is the only cost to receiving the medication. That infusion cost for using the facility, the nursing care, the tubing, that sort of thing, is about $300. That's charged to insurance. Medicare is covering the cost of that, but the drug itself was provided free through the federal government. Most important thing in this treatment is that it be given early. We are only allowed to infuse up to day 10 of symptoms, but the treatment works better, as I've described, if you use it earlier. So when you develop symptoms that you think might possibly be COVID, and that can be sore throat, nasal congestion, what you think is just a regular summer cold, It could be GI symptoms, it could be headache, body aches, fever. Not everybody has all the symptoms. Not everybody has the loss of taste or smell. So if you develop symptoms, and especially if you potentially could have been exposed, although many people are not sure how they've been exposed, seek medical attention early so that you can get diagnosed early, so that then you can be offered the COVID monoclonal antibody treatment, because the sooner you get it, the better it will work for you. So if you think you have COVID, you would seek your primary care physician, who can arrange testing or see you, or reach out, if you don't have a primary care physician, to an urgent care clinic like Velocity Care, where they can test you on site or arrange testing and make the diagnosis of COVID. Once your diagnosis of COVID is made, then your primary care physician or the urgent care where you go could contact the appropriate providers, and they can arrange the infusion for you. We try to infuse patients within the first 24 to 48 hours of finding that they're eligible. Carilion Clinic has a website. On that website, there's information about coronavirus and monoclonal antibody treatments that provide some information. There's also links on that website to the National Institute of Health, NIH, coronavirus treatment guideline, which may have more information than you want, but it has plenty of information. There's a website that's the National Infusion Center Association, and they have information about coronavirus, COVID-19 treatment, and information about monoclonal antibody treatment as well.